Thanks, Eileen. Yeah, so today what I'd like to do for the next 20 minutes is to look at using the data we have in Ireland and see how processed foods relate to health parameters, but also in relation to nutrients and sweeteners. And before we start that, I suppose I just want to go back and think about how we define food types. And normally, as part of nutrition research, when we look at food, and especially in the food consumption surveys, we define them as particular groups. So you can see here, we could have an overall dairy group, and that could be broken down into a cheese group or a yogurt group, and we can look at their attributes in that way. However, new focus is to look at the processing level. So instead of looking at the nutritional components of that food, it's looking at how they're actually processed. So you can have the minimally processed foods, such as the milk, a more processed level, such as cheese, and that goes on to a more highly processed level, where you can see the yogurt there. And there is a few classification systems that have looked at how we can do this. And I suppose the one that was alluded to earlier in Kieran's talk is the NOVA classification system. So for the purpose of this analysis that we've done here as part of the Institute of Food and Health in UCD, I've done it based on the NOVA classification system, as that's the most one used in the literature. As part of this classification system, you can see that foods are split into 4 groups. So you can have the minimally processed foods, and that would be your grains, your eggs, your meat, fresh meat, and your fruit and veg. You can have processed culinary ingredients, the second group, which is your butter, your salt, your sugar, your oils. And then you have processed foods. So that's usually made up of group 1 and 2 together. And that's, you can see, you can have your tinned fruit and veg, maybe tinned in brine. You can have your ham, or you can have your freshly baked bread in that group. And then you have your last category, your ultra processed foods, which is talked about a lot. So that's talking about your biscuits, cakes and buns, your breakfast cereals, and your yogurt. So any foods like that have a number of ingredients are included, and they're classified as ultra processed foods. So using this classification system, and also data from the food consumption surveys here in Ireland. So we have a lot of food consumption surveys completed. And the one that we used for this particular analysis was the National Adult Nutrition Survey, because it has quite an extensive data set with it. So that was completed in 2011. So the methodology that we looked at in doing this analysis was, we combined the national food consumption data, and we looked at the foods that were being consumed, and we tried to link it with the NOVA classification. In order to do this, we went to brand level, because looking at food consumption, it's sometimes not as easy to classify whether how a food fits into the NOVA classification. And sometimes we needed to go to brand level to figure this one out. Once we had done that, we then looked at the percentage contribution of all 4 NOVA food groups to total energy intake. So when we did that, what we found was that the distribution across the 4 groups, you can see that the highest category was from ultra processed foods. So 53% of the daily energy from adults was coming from this particular group. This was the second group was processed foods, the minimally processed foods at 28%, and then processed foods at 16%, and the culinary ingredients at 3%. So that's how the distribution was laid out. So if you focus in slightly more on this ultra processed food group, what do we see in terms of demographics? So when we looked across the demographics and looked across gender, we could see that it's pretty even, the amount of energy between males and females that was coming from this particular group. But what we did note in age, we can see here clearly that younger adults tended to consume more energy from this particular group, 59% versus 46% of over 65-year-olds. When we looked at social class, also we could see a significant relationship, with 57% of lower social classes getting their daily energy intake from ultra processed foods, compared to 50% in the professional and managerial social classes. And also when we looked at smoking versus non-smokers, you can see that 56 versus 51% of energy, with the difference between smokers and non-smokers. So there was a significant relationship there. So next, what we wanted to see is how we fare and how we're comparable across other countries that have done this analysis, looking at the NOVA classification. And you can see this from this graph here. You can see Ireland at the very top here at 52%. And we're very equivalent to our neighbouring country, the UK, which classified at 57% coming from ultra-processed foods, and equivalent to the US as well at 58%. And you can see other countries there have classified less energy coming from ultra-processed food, with Brazil at the least amount at 22%. So the next thing that we wanted to do is to firstly look at how these processed foods link with the health parameters that we could look at. So in order to do this, we undertook some quartile analysis. So basically, as you can see here in this table, we have 4 quartiles. So we split participants within the study into the amount of energy that came from ultra-processed foods. So in quartile 4, or quartile 1, sorry, you've 33% of energy versus quartile 4, where 72% of energy was coming from ultra-processed foods. And then here in this table, we've looked at indicators of obesity. So your weight, BMI, body fat, waist circumference, hip circumference. And we didn't find an apparent relationship with these anthropometric measurements. So other studies have shown that there is a relationship with BMI. However, we didn't see it in our cohort. We did see a weak relationship with waist and hip ratio. However, this was in the opposite direction, in a sense that quartile 4, with the highest percent of energy coming from ultra-processed food, had the lowest waist-hip ratio. Next, when we went on to look at blood pressure, again, split on the quartiles, what we can see is similar diastolic and systolic blood pressure across these quartiles. So again, there was no difference when it came to blood pressure between the quartiles. And next, what we did is we looked at the biomarkers of health. So within this NANS cohort that we have a subsample that provided a blood sample. And we were able to measure their cholesterol levels, their insulin, their glucose. And again, based on quartile analysis, we've looked across at them. And there was 2 biomarkers that did show an apparent relationship. So you can see here for high density lipoprotein, so that's obviously your good cholesterol, there was a relationship in the sense that quartile 1 did have a higher amount of this HDL versus quartile 4. And also we looked at Quickie. So Quickie is a score that is used to look at insulin sensitivity. And we can see here in quartile 1 that they do have a higher amount of Quickie, and that would indicate that they're more insulin sensitive based or compared to quartile 4. So lastly, what we wanted to do is look at an overall marker, I suppose, of health, and that would be to look at the metabolic syndrome. And again, in the literature looking at ultra-processed foods, research has shown that there seems to be a relationship with metabolic syndrome. However, unfortunately, again, we didn't see it in our analysis. So overall in the NANS cohort, 10% of the population were classified as having the metabolic syndrome. And again, if we look across the quartiles here, we don't find that relationship. So there's no real pattern between the quartiles, and they all pretty much had the same amount of participants in each quartile having the metabolic syndrome. So the next thing that we wanted to do was to look at, okay, if we look at this ultra-processed group or foods, how does it link with nutrients? Again, based on our quartile analysis, we can look at the macronutrients. So you can see here, we have overall energy, and then we have our carbohydrates, our protein and our fats, and they're broken down into their different components. And if we just focus on the ones that seem to be having a relationship, we can see that for carbohydrates, we do find that people are consuming more amount of energy from ultra-processed food, have a higher percentage overall energy from carbohydrates. We also see that when we look at added sugar, so not total sugar overall, but added sugar, we can see that there is a significant trend with quartile 4 having more amount of energy coming from this added sugar component. When we looked at total fat, also we could see that they have a higher percent of energy coming from total fat in quartile 4 versus quartile 1. However, this wasn't because of saturated fat. So we didn't find the relationship with saturated fat. However, there seemed to be a relationship with mono and polyunsaturated fat, whereby quartile 4 had higher amounts of energy coming from these components. Also, fibre showed a trend as well, where quartile 4 had the lowest amount of fibre within their diet. And these are not to be unexpected if we go back and look at the types of foods that were showing to be profiled into this ultra-processed food group. And it's very comparative to other research groups that have shown the same type of analysis and the same differences. If we then bring it one step further and look at nutrient adequacy, here we can look at whether participants are meeting the recommendations. So you can see here in the recommendations for these particular nutrients, so added sugar, total fat, saturated fat, trans fat, and salt. And again, split on the 4 quartiles, we can see for added sugar, there's definitely a pattern there, with those in quartile 4, more participants not meeting that recommendation for added sugar, being less than 10% of energy. And the same pattern exists for total fat. However, again, with the saturated fat, we don't see a real clear relationship here. And for trans fat, we do not see a real relationship here. And we've very low, I suppose, levels of trans fats within our diet. And that's due to a lot of reformulation that the industry have done. And salt, we do again see that clear pattern in the sense that quartile 4 had a higher amount of people not meeting the recommendations of less than 6 grams of salt per day. So next we wanted to go on and look at the micronutrient intakes, and that's to look at the minerals and the vitamins across these quartile groups. And there's a lot of data here, and I suppose just to sum that up, we do see a strong pattern in relation to the nutrient intakes, in that it tended to be that quartile 1 had higher amounts of these minerals here compared to quartile 4, apart from iron, where we did not see a relationship, and of course apart from sodium, where we see the opposite relationship, with higher levels being seen in quartile 4, which would be indicative of the high amount of salt in ultra-processed foods. And the same with the vitamins. So you can see here, we looked at the vitamin intake, and we can look that there is higher levels in quartile 1 compared to quartile 4, apart from vitamin D and vitamin E. So there was no clear relationship for these particular micronutrients. And lastly, what we did is we wanted to know, if we look at these micronutrients, could we see then it reflected in nutrient status? So we're lucky, obviously, enough to have biomarkers for nutrient status, and you can see them here for calcium, vitamin D, iron, sodium, potassium, folate, B12, and B6. And what we did is, again, we looked at quartile 1 and quartile 4 against each other and to see if there was a relationship there. And there was a clear relationship in relation to urinary sodium. So we do see that those who are consuming a higher amount of percentage energy from that ultra-processed food group tended to have higher urinary sodium levels compared to quartile 1. For the rest of the markers of nutrient status, we didn't see a clear relationship with any of them in particular. And lastly, before I go on to the third part, looking at sweeteners, I just wanted to do a case study, because sometimes I think we focus very much on the macronutrient and the added sugars and the fats that potentially have a negative consequence, but we forget about the micronutrients and the value of micronutrients within our foods. So here, what I've done is I've looked at the recommendations, just particularly looking at folate. So our folate recommendation is 200 micrograms a day that we should be trying to obtain. And if we look at this based on the current intakes across the 4 quartiles of ultra-processed food, what we can see very clearly is that in quartile 4, 30% of the people in that quartile were not meeting the recommendation. And we can, that's very reflective of the nutrient intakes that we've seen earlier on in the previous slides. However, if we were to model them intakes, and if we were to exclude all folic acid from, so folic acid being the synthetic form that's added into our foods, if we were to remove it from the ultra-processed food group entirely, what would we see in terms of our population is that in quartile 4, if we can see this, that 51% of that group would not meet the recommendations. And as you can see, all groups have tended to increase. So I think it's really important that this needs to be considered as well, those other, I suppose, micronutrients that the foods are providing in the population's dietary intakes. So the last part that I wanted to focus in on is to look at ultra-processed foods and the link with sweeteners. And of course, ultra-processed foods are foods that are, designed by fault. They may have reduced amount of sugars and therefore sweeteners added in to elevate the sweetener taste with the removal of the sugars. So in order to do this, we were lucky to have analysis that have been previously completed to look at exposure assessment in relation to the safety of sweeteners in the Irish diet. So when we did this, we looked at all foods that were consumed that had sweeteners in them. So we looked at the ingredients labels of the foods that were consumed in the adult population. And for those that had sweeteners, we were able to send these products over to Belgium, to the Institute of Public Health there, to analyse the concentration of those sweeteners. We focused on 6 in particular. So they were acetosulfame K, aspartame, cyclamine, saccharin, sucralose, and stevia glycosides. And what we did is we looked at the weight of then the food that was consumed. We multiplied it obviously by the actual concentrations of these foods that had sweeteners. And in exposure assessment of chemical analysis, you divide that by body weight. So you need to adjust it for body weight. And we then look at the intakes per milligrams, kilograms per body weight per day. So when we did this, when we looked at it again across these quartiles of ultra-processed food intake, what we can see is there's definitely a clear pattern. So these are the first 2 sweeteners, so acetosulfame K in blue and aspartame in red. And what we can see, so it seems to be in quartile 4 that there are significantly higher amounts of sweeteners being consumed within this quartile compared to all other quartiles. Now, it is important to note that although there's significantly different amounts of sweeteners, all the sweeteners that were consumed were below the acceptable daily intake. So there's no real safety issues in relation to the amounts of sweeteners that are being consumed in these diets. But we do see that there seems to be a pattern in that there are higher intakes in the ultra-processed food group, quartile 4, when we looked at it. Next, when we looked at all the other 4 sweeteners, again for cyclamide and for sucralose and stevia glycosides, there was no clear pattern. We couldn't see a relationship. There was no difference across those quartiles when we looked at them. However, again, for saccharin, we did see that relationship with quartile 4, so the highest percentage of energy coming from ultra-processed foods, so 72% of the energy. We did find that they did have a higher amount of the saccharin sweetener compared to all other 3 quartiles. So in summary, from our very preliminary, so this is very preliminary data that we've looked at in relation to ultra-processed foods in the Irish diet, there doesn't seem to be an apparent relationship between the markers of health across quartiles when we have looked at it here. However, we do see a clear pattern in terms of macronutrients. So you do see that total fat and added sugar shows a positive association with a greater contribution to energy from ultra-processed foods. And fiber displaying that negative association. But there does seem to be a pattern also with our MUFAs and our PUFAs. Overall, vitamin and mineral intakes do display a negative association, apart from sodium, where it's the other way around, that we see a positive association. And when we looked at nutrient status, we could see that there was that relationship with urinary sodium as well. When it comes to sweetener intakes in all quartiles, it's important to note that they were all below the respectable acceptable daily intake. So there was no safety issues in relation to sweetener intake. However, we do see that pattern with the highest quartile having significantly higher sweetener intake for 3 out of the 6 sweeteners that we reviewed. So I suppose to conclude and to future direction, I think the classification of foods based on processing is inherently difficult when trying to evaluate food consumption at a real population level. And using the NOVA classification of 4 different groupings, I'm not 100% sure if it is suitable. Potentially, we do need a more complex approach to tease out the relationship between processing and health a bit more. Because the processing of foods can have positive attributes, and therefore it's important that we look at trying to achieve the real balance between processing and health. So I finally would just like to acknowledge all partners that work together with me in collecting this data that we're using in this analysis, and also my team that have done a lot of work in helping me get ready for this presentation, and funders from the Department of Ag, Food and Marine that fund the consumption surveys here in Ireland. and to thank you for listening to me.